In this video, we're going to be looking at a special test used in the diagnosis of an Achilles tendinopathy, really a rupture of the entire tendon, and that is the Thompson test. The Thompson test is performed in prone like you see here, but the feet need to be able to dangle over the edge of the bed or over the edge of the table. To perform this test, the PT is going to firmly squeeze the gastrocnemius on the test side and monitor for plantar flexion. Notice as I'm squeezing her gastroc, she's getting passive plantar flexion. So what's important to understand here is that the patient is not actively contracting their gastroc or their soleus to produce that plantar flexion. This is purely a result of squeezing the muscle. Because remember, the gastrocnemius, the muscle itself, has a tendon that goes inferiorly, which is the Achilles tendon right here. Then the Achilles tendon attaches onto the calcaneus. So when you normally contract the gastrocnemius, it pulls on the Achilles tendon, which pulls on the calcaneus and produces plantar flexion. But as I squeeze the gastroc like this, it's actually putting some stretch, some passive stretch, on the Achilles tendon, which then pulls on the calcaneus, and you get passive plantar flexion. So this is obviously a normal response when everything is intact. Squeeze the gastrocnemius and you get plantar flexion. That means a positive test is going to be the absence of movement in the foot, specifically no plantar flexion. So if you squeeze the gastroc and there's no movement in the foot, no plantar flexion, that implies that there's been an Achilles tendon rupture. Something's been done to disrupt the connection between the muscle belly that I'm squeezing and the calcaneus. And just to reiterate this, if there's no plantar flexion with this test, then there's no connection between the Achilles tendon and the calcaneus, meaning you have a positive test, no plantar flexion of the foot. And that suggests that the patient may have a grade 3 strain of the Achilles tendon, in other words, a complete rupture of the tendon. Now the psychometrics of this test are actually very good. The specificity and sensitivity are above 90%. Specificity 93%, sensitivity 96%, meaning that if the patient has a positive Thompson test, there's a 93% chance that they have a complete rupture of the Achilles tendon. But if this test is negative, there's a 96% chance that they don't have a complete rupture of the tendon. Now, there's another way you can interpret this test. Remember that grade 3 strains, complete ruptures, are often painless, or at least less painful than partial ruptures. Partial ruptures being grades 1 and 2 strains. So let's suppose that a patient had a grade 2 strain of the Achilles tendon. Would you expect to see movement here, so plantar flexion with this squeeze? Yes, because if it's a grade 2 strain, that means there's still some connection between the gastroc and the calcaneus. The Achilles tendon wouldn't be completely ruptured in a grade 2 or grade 1 strain for that matter. However, this movement right here of the ankle when I squeeze the gastroc should normally be painless. So if somebody has the movement but also experiences pain with this, that may also suggest they have a grade 1 or grade 2 strain of the Achilles tendon. Now the psychometrics don't address that, but it's just another way you can interpret the results of this test. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.